Right. So this is day. When was your surgery? 6th. Second. Okay. So we are almost 8 days up, and today we are going to do what we call a splint removal. The actual splint is the blue color thing that you see here, which I'll be removing gently. So this blue color splint is a POP cast. No, keep your hand down. I'm doing it gently, okay?
Veining. The veining.
Little bit more. That's it. Okay, hang on. Where is it hurting?
It's hurting here so much.
Okay. Wait, 1 second. One second. Keep your hand down. You'll get hurt otherwise. Just little force, huh?
Not everyone like this only.
Yes. Just that the splint is seated very well. That's it, done. You're done, Baba. That's it. We are done with the major part, okay? And your nose already looks beautiful. So you can see she has a very... Sister, can you get the iPad? She's got a very nice, narrow and long nose which is suitable to her face. Just clean up a bit. This thing, there was a bulge here.
It's swollen.
It's swollen.
But it will reduce swelling.
It will reduce. Little bit, not much. See, cheeks, all the swelling, all the compression happens here.
Okay.
So what happens is when we place a compression dressing, the edematous fluid is all around this area. Okay. So your eyes will be swollen sometimes, your cheek is swollen, little bit, not that much, little bit. But you have comparatively, you have less swelling, especially in this region. Okay. So as you can see, she had a very broad dorsum. Can you keep the mirror a little down? Yeah. She had a very broad dorsum here. We have done 2 osteotomies both sides and narrowed the width of the dorsum. Also, first photo, her tip was drooping and bent down, deviated a little to the right. Correction of the deviation has been done. Koi bhi left side.
Doctor also mentioned breathing difficulty.
1 second. Now you're like a pro. You know what is next, what we are going to tell. 1 second. Look straight. Yeah. You can have a look at the mirror. Okay. So she had a dorsal hump that has been completely taken away, and she has a nice feminine curve, as we call it. Basal view. Now look up. Look up. Yeah. So when we look from the basal view, we can see that the tip is in alignment with the dorsum. Also, there is some amount of minimal edema on one side, but it should settle down. Her tip looks good. Overall, alar base has also been reduced. So she has a lean, narrow nose. And we have taken rib graft for her. It is all healed well, sutures have been taken off. So all you have to do is apply ointment rib side. Okay. Also here, both sides. We're going to remove these two sutures. Okay. Then here at the side of the nose and this part.
Yes, stitches.
Stitches are there. I have to
Then
remove.
remove.
Again, nahi. 2 seconds I'll remove.
Oh, doctor.
Why is it so painful? I could see that. It doesn't pain so much for. That hurt so much.
Not bit.
Then why your sound is so much? For bit you should make small sound, no?
Look down. This is swelling, huh?
Oh, yeah.
It will go down.
Pain, pain.
Yeah, it's fine, it's fine.
I should not laugh.
You can laugh.
Here I get pain now.
When you're laughing,
Ah.
that will become alright.
Doctor Abid, my nose will tell me. As
It's
a
good.
viewer.
It's good. It's just a lot of swelling now. Look up. We have to look down. Yeah, we have to wait for all the swelling to settle down.
How much time?
1 month, 2 months.
Enough? It's feminine. It's natural.
It looks fine. It will take some time. This thing will all. It looks a little bit long now. That's because here there is still a lot of swelling.
Okay.
So once that goes down, the nose will start from there.
Okay.
So it will be
Here I
fine.
have pain, doctor.
To remove the sutures,
Yes.
it'll settle down.